everybody. Happy Wednesday. I'm coming on tonight to talk to you guys about cardiovascular disease. So, unfortunately, this is a really hot topic um, for really a lot of people in this country. And if anything, when the pandemic first started and they were looking at comorbidities, they were seeing, diabetes, obesity, overweight individuals, cardiovascular disease. All of these stuff was actually causing more problems when contracting a virus than any other people that were not healthy. And the part that boggles my mind about the entire thing is that this is not new information, but for the sake of the media and the sake of I guess social media as well, is what's happening is that people are now realizing this. So even for influenza or any other virus that's been around in the past, anybody that's got a comorbidity is always going to struggle more of getting through that than one who's perfectly healthy, right? So in our practices, we focus just so much on health and wellness and just wanting to be optimal at all points. So I wanted to tune in tonight from the functional medicine page and talk to you about cardiovascular disease, what the statistics are throughout the country, because they were mind blowing to me when I was doing research for this video, and, how we can help you and what we can do to get you on a better path. And I can say, out of anybody who's watching this video tonight or that shares this video, um, you can definitely can't say that you don't know somebody who has cardiovascular disease. So if it's not coronary artery disease, if it's not some sort of heart attack or mini heart attack or some blockage of some sort, some open heart surgery, some stents that were placed, whatever the case may be, it starts with the basics of elevated cholesterol, poor diet, being overweight. Sometimes there's a genetic component to it. So we'll do labs on people and we're able to look at the whole genetic composition and elevated markers for cardiovascular problems, et cetera. But what they're also seeing is there's a huge connection with cardiovascular disease and diabetes as well. So again, not surprising, as these things, one thing will escalate into the other. So when we start with one ailment or one disease, the body basically is trying to fight so hard to support that one thing that eventually it dominoes and it dominoes and it dominoes and it dominoes. And in conventional world, you're given one medication for high cholesterol, one medication for high blood pressure. Now we're being put on metformin for your diabetes. The next thing we know, you're being put on insulin, but no one talks to you about the basics of nutrition. Here's some supplements that can help you. Here's some studies that show that these things work. It's just quick push to all these medications. And when you're given these medications, they're not talking about side effects, different things that can affect you. And like I said, these things just domino. So you're on one medication, and the next thing you know, you're on 5 or 6. So in the practice that I'm in, I'd say we get a good mix of people. So we have people that are on absolutely no medication, they don't have any health concerns, but they're coming in just more for wellness visits and doing full comprehensive functional medicine labs. We analyze those, we figure out exactly what's going on, where we can maybe make things better. So it's like a calm before a storm. And that's the type of people that I really like to see, because if we can prevent something, then that would be wonderful. And then we have patients like a sweet lady I had a few months ago who basically put off, she, was considering coming for a while, kind of waited on it. And the next thing she knew, she had a heart attack. And she ended up having some damage done to her heart. She didn't need anything else after that. But to her, then that was a sign to come in. So she came in and we did full workup, and I could 100% see exactly why she had that heart attack. And, the thing was, she's like, I've had labs done every year with my primary care doctor. Or I've had labs done, every year with so-and-so. And no one has ever told me to look at this and to look at that. And they never drew this lab, or they never told me to take this supplement or change my diet even. I've had people come in that have had, like I said, either cardiovascular issues or diabetes, who literally have been told they do not need to change their diet. To me, again, just complete common sense, but that's again why I'm on this side of the realm and not the other. So for me, my background is definitely very conventional. I started in medical oncology and I hung chemo. I was a chemo nurse and I did blood and I did platelets and I did all of that until I realized that there was another side of medicine, went back to grad school, got my master's, etc. But before that, you're just kind of faced with, this is what you know from healthcare, and you're taught the protocols in school, and you're taught, here's these labs, here's these medications to fix these labs. You're not taught, here's what we can do. Of course, they always say like nutrition, but then when you actually go on site somewhere, they're not talking nutrition with patients. They're looking at these lipids and they're saying, oh, here's a statin. Beyond this, we'll recheck your cholesterol in a year. And that's it. And people think that's going to fix it because they don't want to have a stroke. They don't want to have a heart attack. Where for us on the functional side, again, not only am I looking at the cardiovascular markers, but we're looking at the plaque buildup in your arteries. I'm looking at the structure of the arteries to see exactly what's going on and if that artery is strong enough to actually withhold treatment. And then we develop a protocol to help rid the plaque out of those arteries and to help strengthen those arteries. And when we do your follow-up labs in 3 to 6 months, there's proof of that. Decreased cholesterol with no medication. There's decreased plaque buildup in the arteries. There's a nice strong artery that maybe used to be a little bit weaker is nice and looking now. So, there's definitely different ways, and it's not something that you just learn overnight, but it's through excessive training and functional medicine training, IV therapy training, whatever the case may be. So tonight is what I did was I kind of compiled some information, some statistics, and I kind of went over a basic treatment option that actually is going to lead into next week's talk, which is heavy metals. So I'm not going to touch too much on the therapies per se, because we're going to talk about chelation therapy, but I'm going to just talk about the statistics and the studies that have actually been shown through an organization called TACT. So there's a lot of information through like the American Heart Association, et cetera, as well. So let me pull up my information here. So one of the biggest statistics that I found just completely mind blowing. And again, we know that cardiovascular disease is one of the highest things that are out there. But to think that someone has a heart attack every 40 seconds, or that every year 800,000 people have a heart attack, to me, I'm just like, wow, that's crazy. And it's the leading cause of death in all men and women in the United States. The leading cause of death. And again, it's over the years, what have we developed? Processed foods, overpopulation. What is the way to feed the population? To make foods with chemicals. So things in boxes, things on shelves. All of that is contributing to disease and illness. People are more stagnant, especially during this entire pandemic. People are working from home. They're not working. Whatever the case is, they're sitting around a lot more than they ever were. So again, we've had a lot of new patients, coming in over the last few months that have said, I just want to get my health together. If anything that this pandemic taught me, it's that I want to be healthy or that I'm not healthy. And so that's a blessing in disguise. And I'm not sure that they made it out to be that way initially. And I think it backfired on them a little bit with more of the preventative measures. But that's where we're coming into play. So if, we know that medication obviously leads the entire healthcare system, and we're not going to get into that with whole big pharma and all that business. But, the money and the amount of money that's put in to take care of cardiovascular disease every year is completely astonishing. It's over $219 billion that it takes for the United States to take care of heart disease in our country. So if we were to prevent the problem, there also wouldn't be money as well. But again, another topic for another day. So if they're saying that 1 in 5 heart attacks is silent, and again, when I see patients coming into the office and I'm seeing that damage to the arteries and I'm seeing that plaque buildup and I'm seeing the cardiovascular markers all being positive, literally, I say the term, I'm not meaning to scare you, but it's like a ticking time bomb, right? When's that plaque going to build off and decide to rupture? When's that artery going to decide to blow? When is enough going to be enough for the body? When is your bucket going to tip over? So that's the biggest analogy that I always use is your bucket eventually just tips over for whatever reason. So if it's a stressor, a trauma, a pandemic, a loss of a job, a loss of a family member, a pregnancy, anything can cause your bucket to tip. So we have to be cautious and make sure that our bucket's not always almost full, but that it's less full so that eventually we can kind of work that way through so that we don't tip over. Okay. So when the damage is done, but we can prevent hopefully from things going forward. So there's a treatment that we offer in the office, and chelation therapy has been used for over 60 years from the statistics that I found. And so chelation therapy is it's called disodium ethylene diamine tetraacetic acid, so EDTA. EDTA is what we use in our office to bind to heavy metals and or toxins and or buildup, okay? So heavy metals are a big correlation to cardiovascular disease and diabetes, and we'll talk about that in a little bit. But there's a lot of safety trials that are actually being done on EDTA therapy and cardiovascular disease. And I was surprised to find a lot of it as well, because usually when you're looking up stuff and you're looking up information, especially from the American Heart Association, you don't see these things. But there was actually a lot. There's I guess I don't know, it's like a foundation. It's called Trial to Access Chelation Therapy, or TACT. And it was developed and received national funding from the National Institute of Health for their efficacy in their study for chelation therapy in patients with cardiovascular disease. So I started looking into this trial, and I started looking all into it. And guess what? It went through phase 1. And in phase 2, it could prove its efficacy and be FDA approved 100%. But guess what? They won't give them funding. Okay. So now we're seeing that stuff, and I'm reading it and I go, oh, this is why I could find it, because it's showing me that they don't want to prove the point, even though the statistics are there that it works, but we don't want to fund it because, gosh forbid, we actually have a preventative measure to help these things. And that was my opinion. So the one trial showed huge improvement in outcomes in post-myocardial infarction patients, or an MI, or AKA a heart attack. So when they showed that large reduction in cardiovascular events and all the mortality went down, a lot of these subgroups had were diabetics as well. So the diabetic patients were showing to be a high correlation with the cardiovascular disease, which again, like I said, the body just dominoes into each other. So what came first, the chicken or the egg? Was something brewing before that cardiovascular event happened, and then suddenly the endocrine system just went haywire because your adrenals became fatigued or something became off, right? So the pancreas gets stressed out as well. So the results support the concept that this chelation therapy reduces the oxidative stress, reduces the oxidative formation of advanced glycation, which is more in the diabetic atherosclerosis. So the diabetics can have the hardening of these arteries and cause issues, neuropathies, right? You've heard of neuropathy. Diabetics, they can't feel their fingers or their toes, and they have to check their feet all the time, etc. When veins or vessels become atherosclerotic and they become hard, again, is it just due to this advanced glycation that's due to this entire metal buildup that's due to the cardiovascular disease? What came first, the chicken or the egg? Find the entire problem, work up the entire patient, and fix it, my opinion. When we've repeated labs, like I said, on patients at 3 months or 6 months, depending on protocols that we're using, I've never had somebody that's not responded to the treatment. So that's what this trial is saying. The findings and the studies are there, but they're not wanting to admit that it actually can help. So in the other review of it, they were saying that the biggest metal that showed up within the cardiovascular disease in the advanced glycation was lead. So think about our generation currently, okay? So for us, if we were born in the 70s or the 80s, our parents, our grandparents were exposed to lead. A lot of the lead issues were before 1978. So homes before 1978, old homes with paint before 1978, etc. So on our lead questionnaires at our pediatric office, that's on one of them, where you're asking, hey, have you been exposed to a home that's before 1978? And then it leads the kid to more correlation for us to do a lead test. So they're showing that lead induces this oxidative stress in a huge amount, causes inflammation, and it reduces the bioavailable nitric oxide, okay? Our body needs nitric oxide to have lower blood pressure, to not have that oxidative stress, and to flow freely within the body. When we test nitric oxide in patients in the office, which is a saliva dipstick, it's almost like the urine dipstick, but they put it on their tongue in a bed of saliva. When we test those on our hypertensive or cardiac patients, 100% of them are completely deficient. So again, this inflammation is there. What came first, the chicken or the egg? Well, find it. Who cares what came first? Figure out the problems and put a stop to it, right? So not only is it causing this inflammation and this oxidative stress, it's causing the hypertension and the endothelial dysfunction, vascular disease. And there's also a condition that's called lead-induced hypertension, but that was completely reversible once they did an anti-chelating agent or antioxidant therapy in animal studies. So again, not trying to get the animal activists on me for this, but it was what it was. It was studied on animals. And the biggest thing showed that these symptoms dissipated. These animals that had high lead and they had this lead-induced hypertension or this other cardiovascular event from vascular disease, when they did the chelating agent, it improved. So again, there's a lot of evidence that shows that it's a really good thing to do, but it's not the first thing being worked up. Another one of the biggest heavy metals that came into play with cardiovascular disease was cadmium, okay? So cadmium is just one of those things that when we look at the heavy metals test, people are like, what the heck is that, okay? Cadmium can be used, I mean, it's been shown in batteries, it's been shown in different automotive industries. I mean, the options are endless, okay? So when we look at it, it's associated with clinical signs and symptoms of this intoxication for hypertension, stroke, MIs, peripheral artery disease, and even death in a higher amount, okay? It may contribute to the progression of this atherosclerosis, so it's gonna harden those arteries even more, damaging the DNA, increasing the oxidative stress, and it's connected to an increased risk of premature hardening of that arteries, and it's going to function in the induction of occlusive atherosclerotic disease. So cadmium increases in amount, makes more of a hardening vessel, which leads to more cardiovascular issues. So now we got a weak vessel, we got plaque, things are hard, things are building up, we're having a heart attack, all right? So again, anti-chelating agent goes in, look at it as a broom response. We're sweeping out those arteries. Rotatilling, I guess is more the medical term if you're going to go in and, you ever hear people go in and they go through their groin, they go into their arteries and they clean them out. So the same thing can be done with an anti-chelating agent. And we do see that. Diabetic patients have shown to have a higher urinary concentration of metals such as cadmium. So it's, again, just one of those interesting things with diabetics. And again, they just go hand in hand. And I see a lot of it in the office. We maybe see a pre-diabetic, but that goes to show that there's some sort of damage or some sort of oxidative stress that's happening. And these patients are really struggling from it. And not all of them even know that that's the case. They just get their blood work done and they're finding these types of things. And the next thing they know, oh, wow, I didn't realize I was that bad. I get people in that are in their 30s or 40s and they have a really increased amount of cardiovascular markers. And I say, honestly, even though you're 36, even though you're 42, you're a ticking time bomb. And you have kids, you have a family. We got to get this taken care of. And, we try to get them on the protocol right away. We try to get them on the supplements what we can. We try to do this therapy and really just embed into those arteries, clean them out, and allow their bodies to really just detoxify before there's another problem. The younger we are to address a symptom, the better our organ function is going to be, the better our detox pathways are going to be, and the better everybody's going to feel as well. So we don't tend to have as many side effects. People have, some people will really lose a lot of energy if they have a bunch of different comorbidities because the body is working in overdrive so hard and so much to get through the process. So again, if we can address these symptoms, that would be a wonderful thing. There's a lot of people that are like, oh yeah, well, I haven't been to the doctor in 10 years. And so I don't know what things look like, but my uncle or my grandpa or my dad or whatever had a heart issue or had a heart attack. And we can help with that. We can screen with that. We can really just hone in on the cardiovascular part. And again, for it being the biggest cause of death in the entire country, we should be taking care of all of these patients. The benefit from the TAC trial as well is that if they can receive the second part of their funding, which they're really pushing to do, and it's still in progress, they're hoping that cardiovascular physicians and endocrinologists all over the country will start to utilize this stuff. I went to a conference in July in Florida, and I was with, it was an IV therapy conference, and I was with a neurosurgeon, a rheumatologist, and a general primary doctor who was switching into functional medicine, all three of them. It was mind-blowing to hear their stories. So on break, the neurosurgeon was sitting behind me, and I talked with him, and I said, you got to tell me, you're a brain surgeon. Why are you coming in? What's your story? Because we all have a story. We all have a story as to how we got here. So I wanted to know his story. And he said, the amount of procedures that I do on a regular basis and I go into these people's brains, and if I'm not cleaning out different things, right? So if it's not from different bleeds, little mini aneurysms, little mini strokes, whatever the case may be, if he's not fixing that, he goes, most of the time it's already too late, like the damage is done. But if I can prevent that, and if I can find a screening tool to help me prevent that, he's like, people will be better. He's like, all I do is fix the bad. He goes, I want to make it good before it gets bad. And I said, exactly. Like, that's why we're here. So we were comparing, he was brand new to the process. So he hadn't actually been started doing any therapies in his office. And, I was kind of just sharing some patients and some findings that we found and some different studies that I found. He was just mind blown. And again, the stuff is real. And I've had people with ejection fractions, which is the percentage that your heart's functioning. I've had people with ejection fractions super, super low. We go through therapy and we monitor you the entire time through therapy. We're checking blood every 5 bags just to make sure everything's going fine with your organ function. And so we were monitoring her. At the end of the treatment, she had a repeat workup with her cardiologist. They did a scan and they said, oh my gosh, your ejection fraction went up. And it was up like 15, 20%. He goes, you're not in heart failure anymore. He's like, you have to tell me what you did. She told him, and he's like, no, that wouldn't do it. Okay, so I guess the heart just kind of reverses on its own. I'm not too sure. And that's fine. But same thing happened with a diabetic last week. She was 6.4. She was full blown diabetes. It's been out of control for years. She was on medication. She was on 2 types of insulin and a medication at night. So we started weaning her off her medication. I actually saw her for the first time in June. Started weaning her off her meds. We started focusing on diet. We took the sugars away. We detoxed it. We fixed her gut because she had some candida that was feeding the sugar. Fixed all of that. And her body responded so well. We repeated her A1C 5.8, considered pre-diabetic, out of diabetes zone. She was amazing. She was doing wonderful. She felt great. She lost 20 pounds. Her body wasn't struggling anymore. It wasn't fueling the fire. We were assisting it in the right process. So that's the stuff that's functional medicine's all about. It's finding the root cause, figuring out how to help it and what we can do to help it. And not always is it that simple. Sometimes we really have to dig hard and we have to figure out exactly, what's going on and how we can make it better. But we don't give up with that. If we do a workup on you and there's more going on, like I have so many resources throughout the country and we communicate together because not every one patient or situation is the same. So we have to be able to rely on our colleagues and know exactly what's going on with people because our goal in the end, we all share the same mission and vision, which is to make people better, figure out the root cause, fix the problem so that we don't have any side effects or lingering effects from any of that. So that is like a nutshell of cardiovascular disease and what we have to offer for that. So again, like I said, if you guys share, if every single person that's watching this, which is a lot of people, if everybody can share this video and you can share it with one person, if you can reach one person by sharing this video, it's one more person that's not going to be that statistic to die from a cardiovascular event. And most of the time when we can do super bills that cover through the insurance for lead toxicity, they don't like lead toxicity in the insurance world, and it works really well for coverage as well. So we do help you on our side from what we know and our knowledge to be able to get things covered for you as much as we can. So definitely, feel free to call and schedule an appointment. Our information is on our Facebook page. If you haven't liked our page, go ahead and like it. Like I said, share the post. Next week, we're going to be talking about heavy metal toxicity and what that involves. I think that's a really hot topic in the country for sure. And then the following week, we're going to be talking about leaky gut, some candida issues, and inflammatory stuff within the bowel. So if you guys have any of those relations, which I can tell you probably every single person that's watching this video has some sort of gut disruption. So if anybody's dealing with that, make sure you like the page, tune in for the events, excuse me, click that you're attending the event or that you like the event so that you get alerted so that you can get the notifications on when we go live for this stuff. So if you guys have any questions, definitely don't hesitate to reach out. You can contact us through our email, which is on our website, or you can call our office. So everybody have a great evening. Hopefully this week goes better than it has the last 48 hours, and everybody stay well. We'll talk soon.